Hey guys, welcome back to the Sullivan family. So this video is all about my journey with angina, right the way through from getting the initial symptoms to realising I had it, to going to the GP, going then on to the cardiology department, going through the various tests, and then coming out the other side after having treatment. And that's what this video is all about. It's basically about how I've got on over the last 12 months to where I am now, and just explaining a bit about it. So quite simply, about 12 months ago, I started to get these symptoms when I was out walking, especially when I was out walking, or if I was out doing anything strenuous or anything like that. I started to get these symptoms, which I can only describe as almost like indigestion mixed with when I used to go out running in the cold, that kind of sharp feeling you get at the top of your lungs. And it was primarily here in my left side. So I started to get these feelings, these kind of pains, if you like, when I was kind of exerting myself. So say if I was walking up a sand dune, or if we were walking up a steep hill or anything like that, I would start to get these symptoms. And also if I was doing a very quick walk, if I ran up some stairs, if I was doing any of those sorts of things, I would get this pain. And when I stopped for a minute, it would then just subside, it would go away. So I spoke to Zoe about it. And if you've not been on our channel before, Zoe is my wife. So I spoke to Zoe about it, and we kind of said, well, is it indigestion or not? Because I was already on these drugs called omeprazole, which are for indigestion and stomach relief and all that kind of stuff, right? So I thought it could be indigestion. We'll monitor it, see how it goes on, see how it goes. And then, yeah, I didn't think too much of it, to be honest with you. I didn't think too much of it at all. But what I did notice with it as well was I was starting to get tired. So I'd have to stop and just catch my breath again, or like I couldn't. So I'd struggle to have a conversation if I walked up a hill. And bearing in mind, quite a few years ago now, but I used to run up these hills. You know, when I was in the Air Force, I used to run up these hills. I did a lot of running. So for me, it was a question of, well, is it age? Because I'm 48. Is it fitness level? Is it all those sorts of things? What is it? But anyway, I went on for another few months, and then I happened to overhear a conversation with one of the guys that I work with, Dave, who was explaining his symptoms, his angina, and his treatment, because he's fixed now. It's completely fixed. And it just ran an alarm bell in my head. So I had a quiet chat with him. I took him to one side, I had a quiet chat with him, and I said, can you just explain a bit more about what you got? So he explained how he got a very similar symptom to what I did. He then went to his GP with it. His GP put him on all the different drugs that you put on, the statins, the blood thinners, the aspirin, all those sorts of things, and the GT spray, which is a spray you spray under your tongue, which relieves your capillaries, your arteries, and all that kind of stuff. So we had a conversation about it. And I just went, that just sounds exactly like what I've got. It sounds exactly like the same symptoms that I've got. And he said to me right then and there, he said, go get it checked out. He said, just go and get it checked out. Even if it's just for peace of mind, go to your GP, go and get it checked out. And thankfully, thanks to Dave being big enough to tell everybody about his symptoms and his journey, I did that. I went to the GP, explained my symptoms, then we got talking about family history. So there's heart disease in both sides of my family. So my dad's had a heart attack, and I know that a lot of my family have had a heart attack in the past as well, in both sides of my family. That's my mum and my dad. So there's already that history. Explain the symptoms. I don't drink or smoke or anything like that, but still, you know, you can still, it doesn't matter. In fact, along this journey, I've met people that are top cyclists. You know, there's guys that have had a heart attack and they are as fit as a butcher's dog. This thing doesn't just affect people that are overweight. It doesn't just affect people that smoke or drink. It doesn't just affect a stereotype of people. things like heart disease and all these sorts of things can affect anybody, and it doesn't matter if you're 40 or 70, it can affect anybody, trust me. And that's what I've learned along the way, actually, just meeting the people in the various waiting rooms and having a chat with them and realising, actually, you know, you think to yourself, have I just been unfit? Have I not looked after myself? But there's guys out there that cycle 60 miles on a weekend, you know, and they still, there was one guy I was talking to who actually, he was in the middle of a cycle and with friends, obviously, with other like-minded people, other cyclists, and he dropped down with a heart attack and he got airlifted to hospital, and then he had stents fitted, and the rest is history. But he was back in again, getting checked out while I was in there. So what I'm trying to say is this thing can affect anybody at any time. So you've got to look out for symptoms. You've got to look out for pains and anything like that. And you've got to act on it. You've got to listen to your bodies, and you've got to act on it. And you've got to get these things checked out. So anyway, I went to the GP. We had the whole conversation about my symptoms and all that sort of stuff, my family history. We had an ECG done, which didn't really show anything, to be honest with you. But to be on the safe side, she put me on all these drugs. She put me on statins, aspirin, all these sorts of things to kind of help. They basically lower your cholesterol and they thin your blood. So if there is any risk at all, then you've already started the treatment, if you like. So I had my ECG, and she marked me a 7 out of 10 on risk. It was 50-50 whether she was going to send me to cardiology or not, but I kind of insisted, and I said, look, I would rather get it checked out and be happy in the knowledge that there is nothing wrong or there is something wrong. Yeah, and at least I can get it treated and get it early. So I went along to Dr. Gray's. That was the next port of call. Was going to Dr. Gray's Hospital in Elgin, where I had a sonograph done of the heart, like a full sonograph done of the heart, so the cardiologist could have a look and then get back to me at a later date. So that was all done. Anyway, fast forward for about 3 or 4 weeks, and I get a letter through the post and a phone call actually from cardiology in Elgin that Dr. 𝚘𝙗, who is the cardiologist, one of the cardiologists up here, wanted me to come in for a checkup and basically an assessment. So I did that. So I went in, spoke to Dr. 𝚘𝙗, went through the same explanations, the same conversations about history, symptoms, all that kind of stuff. And he said, he was a bit like that as well, but he said, no, let's get it checked out. Let's get you assessed properly. And in the interim, he gave me the GT spray, which is this spray that if you get these symptoms, you spray it under your tongue, and that relieves that symptom. It relieves the arteries and that kind of stuff. So you had to keep that. I had to keep that on me, and in fact, I've still got it on me now. It's a GT spray. There you go. So you spray it under your tongue. If you get any serious symptoms, you're supposed to use it. So I went along then to my first appointment in Inverness, cardiology, for an MRI scan. So that's where this journey begins, guys. It begins with me going over to Inverness for my MRI scans to assess they're called nuclear tests on your heart. That's where this begins, guys. So I'm going to hand you over now to myself, to my other video, and then I'll catch you after. Hi guys, so it is the 4th of October. It is Thursday the 4th of October. No, it's not Thursday at all. It's Wednesday what day is it? Wednesday the 4th of October. It's Wednesday the 4th of October, guys. I am over at Inverness to go to the Nuclear Medicine Centre in 𝚘𝙾𝙽𝙼𝙼 Hospital in Inverness to get an MRI scan of my heart. I'm there for about 3 hours today, so it's going to be quite a long day. I've not had any caffeine for a day, for 24 hours. No caffeine for 24 hours, no chocolate for 24 hours, no nothing. So, you know, the price we paid, no caffeine. My goodness. It's the first thing I go for in the mornings is my coffee. So I'm over in Inverness now. But unfortunately at 𝚘𝙾𝙼𝙼 Hospital, hang on 2 seconds. Sorry, Zoe was phoning me. She was just phoning to see how I'm getting on and where I am and all that kind of stuff. Yeah, so I got to 𝚲𝚃𝙽𝙼 Hospital. There's construction work going on, so they've lost over 200 spaces. So one of the guys I was speaking to in the day glow in the car park, he was saying we've lost over 200 spaces. It is absolute carnage. So anybody that lives up here, right, I'm just warning you now, the parking at 𝚲𝚃𝙽𝙼 is absolutely horrendous. It always has been pretty tough, but it's pretty horrendous at the moment. They've lost 200 spaces and they're directing you up to the retail park. So I've literally driven out of 𝚲𝚽𝙽𝙼 Hospital, and I've parked a couple hundred yards up the road at the retail park because I've got no choice. There is literally no spaces there whatsoever. So just to warn you guys, if you are from up north Scotland and you're going over to 𝚲𝚽𝙼, give yourself plenty of time to sort out parking because it's absolutely a nightmare. Anyway, yeah, so I'm up here now, going to the nuclear medicine centre. Like I said, going for my scan. I'm going to be here for quite some time. I'm going to be here for about 3.5 hours, I think. But I got some lunch because it said on the instructions. It said no coffee, no nothing, no fizzy drinks, no fun, no chocolate, no nothing for 24 hours. But once you've had the injection of nuclear stuff, radioactive stuff, once you've done all that, you can then have a lunch break, which is good, isn't it? So I've got myself a meal deal from Tesco's. Look at that. So yeah, right, anyway, I'm about to get extremely wet. I'm going to walk down to the hospital now and get myself sorted out so I'm in, because I do like to be prepared, and I do like to be ready to go and in and done. So I'm going to go now, guys, so I'll see you in a bit. That's me, guys. I'm just waiting for my appointment now, so I'm not going to be able to vlog much, obviously, inside. So I shall probably now catch you after this appointment. Okay guys, that's me back in the car. So obviously I couldn't film very much in the hospital. It was really difficult. So I've been in the hospital for what, I got in there, what, 11 o'clock ish. It's now coming up to 20 past 3. So I've been in there for a good 4 hours. But yeah, so I went in there. I had initially they had to put a cannula in, had to have an injection that puts your heart under pressure. This drug puts your heart under pressure. They did this, obviously an ECG, and then I went in about 45 minutes to an hour later for my MRI scan. Oh, after I'd had the, so they have to give you this radioactive stuff that they inject into your arm as well, and that has to all bed in. And then after about an hour, you go in for your MRI scan, CT scan, and that's it. So I've been waiting around for about half an hour to see if they need me back tomorrow, because there's potential that they need me back for tomorrow, and they do need me back for tomorrow. So they want me back for tomorrow at 1:30. So that kind of cocks our plans up a little bit, but you know, I'll have to phone work and let them know what's going on and come back tomorrow for the follow-up. So yeah, so all good for the moment. I'll come back to you again tomorrow when I come back for the second appointment, and we'll have a chat again. But yeah, so that's the main appointment done. Now it's on to the second one. Okay guys, so it's Thursday. It's now about 4:30. I got over to 𝚘𝚾𝙽𝙽𝙴𝙲𝚃 Hospital again about 1:30 by the skin of my teeth, because there's so many roadworks going through Nairn that it was like a 45-minute wait going through Nairn. So I got here, so I couldn't do much filming, and obviously can't do much filming in the hospital. But I've been here for about three hours again, waiting for another appointment and get myself sorted out. So this time they want to do a scan on my heart while I'm more rested and all that kind of stuff. So that's been done again now. So I've been sent away. Now I'm waiting results, so which could be up to 10 days. So what's the date today? Is it the 5th today? I think it's the 5th today. So probably in 10 days time I'll come back and I'll have an answer, and we'll see where we're going. But yeah, so just another part of the journey. I'm going to head home now, and I'll catch you in a few days. Okay guys, so I've got a bit of an update for you. It is 8:10 on the, what even is the date today, seriously? The date is the 16th. That'll be the front door. Hang on 2 seconds. That's just the girls back from shopping, so I've just snuck into the girls' room, just because it's quiet in here for 2 minutes. I'm going to leave them putting the shopping away for a second. So, following on from the MRI scans, so how long ago was that now? Well, it's the 16th now, so it's, when was that? Well, it must be about 10 days ago. Something like that, I'd have to look on the calendar, but I think it's about 10 days ago anyway. So I had the MRI scan both days, so I had, was it the Wednesday and Thursday? I can't remember, I'm useless at remembering things. Anyway, I was at 𝚘𝚾𝙽𝙽𝙴𝙲𝚃 for 2 days. Yeah, so I was at 𝚘𝚾𝙽𝙽𝙽𝙃 for the 2 days where I had MRI scans. I had that radioactive injection put into my bloodstream twice, and then the first day I had that injection of medicine that makes your heart beat super fast and all that kind of stuff. So that's all done, right? So I was waiting for the results. So I had the results today. So the cardiologist phoned me today. Now they have found something significant. The way he described it is there's a lack of oxygen supply in a significant area of my heart. So number one, yes, it's not great, but number two, I'm really happy that I went and got it checked out, because now we know that there is something wrong and we can get something done about it. Do you know what I mean? So I'm obviously I'm on the drugs as well. So there's 5 different drugs I'm on as well. There's a statin, there's blood pressure drugs and all that kind of stuff to help me, and the spray as well, just in case I get the angina. Then I can take the spray and that relieves the angina. Yeah, so I'm now going to 𝚵𝚃 Royal Infirmary. I don't have a date yet, but the cardiologist did say he's not going to hang about. He's got 3 appointments before, well, it sounds like in the next week. So I'm going to wait and see what date I get for that. So it's going to be going over for an angiogram. I think that's where they put the thing up your vein and go and check your heart out. So it's going for an angiogram, and then most probably a stent is going to be fitted. So realistically, yes, it's all worrying. Yes, nobody likes to be going through procedures and all that kind of stuff. Nobody really likes it, do you? You just want to get on with your life. But on the flip side of all of that, I can't reiterate enough how thankful I am that my colleague at work, my pal at work, mentioned all of this, because if he hadn't mentioned any of this, I wouldn't have known to even have got it checked, because I'm 48, so I wouldn't have really thought about getting it checked, and I thought it was indigestion. So for me, it's like, yeah, I'm glad I got it checked now, because now I'm getting something done about it. So on that note, I'm going to stop there, because that's a quick update on where I am. I've just after the phone call today, and now it's just a case of waiting for the appointment in 𝚵𝚃 Royal Infirmary to get this stent fitted or whatever they're going to do, get the angiogram done, and then hopefully I'll be fixed. So fingers crossed, eh? Anyway, the next time I speak to you, I will probably be on my way to Aberdeen. Okay guys, so it's the 18th now. It's the 18th of October. It's actually about 7:30 at night, so everybody's in bed. Just another update from me on my next appointment at Aberdeen Royal Infirmary. It's come through. So I spoke to the cardiology consultant's PA today, and I've got an appointment now on the 3rd of November. And that's just after we come back from our little holiday to 𝚆𝙗𝙃 again. And I did say, like, is there anything to like worry about? You know, so I'm gonna be going away for a week or so, and it's not going to be until the 3rd. She said if the cardiologist thought there was an imminent problem, I wouldn't be going on my holiday. So there is a problem. I need the angiogram to check it out, and if I need a stent now and then, I'll have the stent fitted. But it poses a problem because I need to get over to Aberdeen on the 3rd, which is about an hour and a half to 2 hours travelling. I can't take my car because if I take my car, I'll have to leave it there because you're not allowed to drive afterwards. You're not allowed to drive, and you're not allowed to take public transport. So I've got a bit of a dilemma on what to do, because obviously Zoe will be at home with the kids. And she can't get me over there for it's 8 o'clock in the morning. I've got to be there, so she can't get me over there. So it's either going to be train, or I don't know really. I might even ask about and see if anybody's going over to Aberdeen, or if anybody could give us a lift as well. So some of the people that I know. So it's caused a bit of a conundrum at the moment because I can't drive myself because I'd have to leave the car there. If I get the train, there's a train that gets into Aberdeen at about 7:30 in the morning, so I could do that and then get a taxi to the hospital. But then it's getting back, so like Zoe's gonna have to pick me up, but we don't know how we're gonna do it yet. So obviously the older kids will be home, so that'll be fine, but she's gonna be gone for about 3 hours, 4 hours. And Zoe's not very confident with driving, especially at night, so we'll have to just see what happens. But at least I've got my appointment. Hopefully this will fix all the problems and I'll be back to normality. But I don't think I can drive for about a week afterwards. So we'll have to see what happens with work and everything else. But I'm just glad I've got my appointment, to be honest, and we'll just work the rest out as we go on. So yeah, so a bit of news for you. And the next time you'll see me now will probably be after the holiday, and we'll be on our way to Aberdeen. Okay guys, it is the 2nd of November. We are back from our week away in 𝚆𝙗𝙃 in the Snowy River Lodge, which was fantastic, by the way. It was just what the doctor ordered. We loved it, loved every minute of it. So I have a bit of an update before I go to Aberdeen tomorrow, because obviously it's my appointment for my angiogram, potentially angioplasty, which I think they probably will do, is give me a stent. Put a stent in my heart. So I've taken all of my drugs that I was supposed to have taken. There was 8 drugs I had to take today. I've got to take more tomorrow morning. I'm nil by mouth from midnight tonight. And we finally sorted out the transport problem. So a couple of the guys that I work with have stepped in to help us out, which is absolutely brilliant. So I've got Jason giving me a lift over in the morning at 6 o'clock. Bless him, honestly. I'm going to give him some petrol money for doing it, and I couldn't be more thankful, honestly. And then Finn's going to pick me up later on when I'm finished, so I could be there for about 8 hours, but he's going to come over after work, and he's going to come and pick me up, which is brilliant, because I'm not allowed to drive myself, I'm not allowed to drive back, and I'm not allowed to get public transport either. So everything's pretty much sorted out. My lift is sorted out. I've taken my medication I'm supposed to take. I've packed stuff. Not that I've got to pack much, but obviously I'm going to pack stuff. I think I've got quite a bit of time where I'm sat down doing nothing, so I think I'll edit a video, which might be quite cool. Because I've still got the last day at the lodge video to edit at this moment. I know that's total tangent. Anyway, yeah, so I'll probably do a bit of that. But no, I'm just happy now to be going over, getting sorted out. and then getting back on with my life, which would be great, you know, because these things are, it's a phase, or it's a real favourite quote of mine from Only Fools and Horses. It's a dropped stitch in life's tapestry. That's all it is. So going to get sorted out tomorrow, and hopefully all being well, that'll be it. So I'm going to try and film as much as I can tomorrow, guys. Obviously, depends what I can and can't film. I'm not really sure. I probably won't film the journey over there, but I'll try and film a few things while I'm over there, just to keep you updated on what's going on and that kind of stuff. But anyway, that's it for now. It's off to the hospital tomorrow, to Aberdeen, and fingers crossed everything goes all right. Okay guys, it's 7 o'clock in the morning on the 3rd of November. I am at Aberdeen Royal Infirmary. I've just been dropped off by Jace. I'm just trying to find my way now into the main entrance and the outpatients, just to go and find out where I've got to go. So, oh, I think I'm going down here. So like I said, I will try and do as much filming as possible today, but I will see how it goes. So I'm going to try and find where I've got to go and get myself booked in, but here we go. Okay guys, that's me finished at Aberdeen today, Aberdeen Royal Infirmary. It's about 3 o'clock in the afternoon. I've ended up having 2 stents fitted, which was surprising actually. I thought I was going to go in for 1, but I ended up with 2 stents fitted. But I'm now waiting for my lift, and when I get home I'll explain it all to you, all to you a bit better. So anyway, I'm just happy that I've been fixed. So I'll get to you when I get home. So there we go guys, so it's now the 5th of November, and I've been home for a day now after getting my angioplasty, where they fitted 2 stents in my heart. And when I'd actually watched it on the monitor as well, and when Dr. 𝚘𝙗 had shown me the before and after, it blew my mind, honestly, because the arteries had thinned so much in 2 places that if I hadn't had this treatment, I don't know where I'd be in the next couple of years, to be honest with you. I would have more than likely been on the verge of a heart attack, because seeing it for real after going and having the stents fitted, seeing that for real, and seeing how blocked my arteries were, not completely blocked obviously, but how thin they were in certain places, and they then give you this amazing magical treatment, which is just like bonkers. I mean, they go in through your wrist or groin, but they went in through my wrist on this one, and they put these balloons in with the stents on, and you can see it all happening. And when they inflate these balloons in the right place to fit the stent, you get the angina pain, but like 3 or 4-fold, you know, while they're doing it. But then it all kind of relaxes off again, and you can instantly see on the monitor the blood flow going through your heart again, and it's like, wow, that's insane. I mean, what people did before angioplasty, I don't know. You know, maybe they just had lots of drugs and lots of treatment. So yeah, so that was all done. I was absolutely exhausted when I got home last night. I mean, obviously you probably saw from the vlogging, the little bit of video that I did outside of the hospital. I was absolutely knackered. I was just waiting for my lift home. So I got home last night and then just crashed, and basically just today we've just been taking it easy, not doing a lot. I'm not allowed to drive for a week. I'm not going to work for a week. I'm just resting. I've got to be very careful. And I'm now permanently on drugs. So permanently on aspirin for the rest of my life, one aspirin a day. I'm definitely on the statins, and I'm definitely on some of the other drugs that they've prescribed, which are, give me 2 seconds. So yeah, I'm on 𝚲𝚃, which is one of these drugs that relieves the pressure in your arteries. I'm on ramipril as well. I'm not sure what that is. Some of these are like statin drugs to reduce your cholesterol and stuff. Atorvastatin is another one that I'm on now. So I'm still on all of these. This one, 𝚆𝙼𝙼𝙼. There you go. So I'm on that for 6 months. This is like a strong blood thinner. And then I'm on aspirin now for the rest of my life. So I'm on 1 aspirin a day for the rest of my life. Yeah, so I'm on these drugs now. I'm going to be going in again for a checkup in 8 weeks. After 6 months, I will stop taking the stronger blood thinner, the 𝚆𝙼𝙼𝙼. Oops, sorry, 𝚆𝙼𝙼𝙼. We'll stop taking that. But as for the rest of it, I'm going to be pretty much on these drugs for the rest of my life now, because obviously I'm fixed, and the stents will stop me from having a heart attack. But to keep the stents free now is well, it's just being careful with my diet, it's being on these drugs, it's all that sort of stuff, you know, and just realising actually we need to keep an eye on what's going on. And now from now on, I will always keep an eye on any chest pain or anything like that. I will keep an eye on, and I've got open access to the ward as well, so I can phone them over the next few weeks if there's any problems as well. So I'm just happy that I've been fixed. It was caught early because my dad had a heart attack, and it severely restricted his life because he lost, I think, about 40% of the use of his heart after having a heart attack. So for me, I can't thank Dave enough that day for chatting about it as well. If he hadn't talked about it, I might not be getting checked right now. I might still be, you know, going around and struggling and doing what I was doing, thinking I had indigestion or whatever. So I'm really glad he said what he said, which then made me pay it forward. This is me paying it forward. So for anybody watching this video, guys, all I can say to you is listen to your bodies, listen to what they're saying to you. If you're worried about anything, it could be blood, it could be pain, it could be lumps, bumps, moles, whatever, get it checked out. Get it checked out. I've had other things checked out as well. I've gone straight to the doctors with prostate issues, and they've been treated. So this is just me saying, not just men's health, this is everybody's health. You know, if you're worried about anything, go to your GP, go check it out, go get it checked out, because you just never know. And I'm so glad I did, and I'm so relieved I did, and it just means now that I will also get monitored now for, you know, regularly for any issues. So my heart will be monitored. So I feel very, very lucky that we've been down this road and we've got treatment, and it's been sorted out. So thumbs up. Anyway, guys, that just leaves me to say a massive thank you to Dr. Grace Hospital, to Inverness Regmore Hospital, to Aberdeen Royal Infirmary, all the cardiology support there, my GP, everybody that's been involved in helping me out here. They've been absolutely fantastic. I mean, the cardiology guys as well are brilliant in all the hospitals. They do an amazing job. They're really, really helpful. They really look after you, and they make you feel at ease. And the guys over in at Aberdeen were amazing as well. They really, really put you at ease. They make you feel really welcome. They explain everything, and right the way through the whole process, and it's been absolutely fantastic. So I can't thank the NHS enough. Anyway, guys, I really hope you enjoyed this video. Please subscribe to our channel if you haven't already. Please hit the bell for notifications, drop us a like. Don't forget our link to the video description below for all of our social media, our Facebook, Instagram and TikTok. And just remember, guys, don't be afraid to speak about stuff. Don't be afraid to go and speak to your GP about anything you're worried about. And everybody take care. Cheers.